Hello, dear students. My name is Медведева Anna Valentinovna. I'm assistant of professor in the department, pathological department of Saratov State Medical University, and today I will read you the lecture about diseases of cardiovascular system. Which diseases we will discuss today about atherosclerosis, hypertensive disease or essential hypertension, ischemic heart disease or coronary heart disease, and cerebral vascular disease. And first, information about atherosclerosis. What's this definition? It's a chronic disease appearing as a result of lipid and protein metabolism derangement and characterized by arterial involvement of elastic and muscular elastic type, large and middle, in the form of focal deposition of lipids and proteins means cholesterol in the arteries, intima, and reactive growth of connective tissue. Which etiological factors of atherosclerosis? It's metabolic, exo and endogenic factors. These hormonal factors, estrogens are anti-atherosclerotic factors. Hemodynamic factors. Due to increased viscosity, we can see more fast appearance and growth of atherosclerotic plaques. Neurovascular factor and hereditary and ethnic factors. In this photo, you can see normal large artery, elastic type of artery without pathological changes. And in this photo, you can see atherosclerotic plaque and decreased volume of artery with the growth of connective tissue, empty zone. Means accumulation of cholesterol, and this violet zone means calcification, petrification. Morphological change and morphogenesis stages. There are 4 microscopic and 5 microscopic stages of atherosclerosis. Anatomical stages of atherosclerosis. First stage, fat stain or yellow stains and strips. Stains and strips of yellow color not raised above the intima surface. We see accumulation of cholesterol in the intima. Second stage, fibrous plaques. We see growth of connective tissue, reactive growth of connective tissue, solid elastic whitish formations, raised above the intima surface. It means atherosclerotic plaque. The next complicated plaques or complicated affections. This means atheromatosis. Ather means necrosis of plaque. As a result of necrosis, we can see hemorrhage in the plaque and formation of thrombi as a result of rough of intima. And the last stage, atherocalcinosis, this petrification. In the zone of necrosis, we see accumulation of calcium salts. As a result, we see very, very solid consistency, the stone white color. In this photo, you can see different stages. In the downside, we see first stage. We see only several yellow strips and points. In the middle aorta, we can see fibrous plaques, and in the upper side, we see complicated and calcification with destruction of intima and formation of rough surface in the intima. In this photo, you can see complication, hemorrhage in the plaque. What about microscopic or histological stages of atherosclerosis? I told that we see 5 stages. First stage, prelipidic stage. Anatomically, we can't see some changes, but we see increase of vessel wall permeability. In the next stage, lipidosis corresponds to fat stains and strips. We see accumulation of cholesterol fats in the intima of artery. The next stage, liposclerosis, corresponds to fibrous plaques. We see accumulation of fats and growth of connective tissue around zone of accumulation of fats, the reactive growth of connective tissue. The next, fourth stage, ateromatosis, corresponds to the third stage, anatomical stage, and 5, aterocalcinosis, corresponds to the fourth stage, anatomical macro stage. In this photo you can see lipoidosis, special staining Sudan 3. Orange color means accumulation of fats in the intima of artery. In this photo you can see in the left side normal artery, in the right side a fibrous plaque. We see empty zone means fat accumulation, and growth of connective tissue and formation of fibrous plaque. In this photo you can see aterocalcinosis, growth of connective tissue, zones of necrosis, fat accumulation, and violet color means calcification or petrification. And in this photo you can see this volume of artery, about 5-10% of all volume. In this zone we see formation of plaque, atherosclerotic plaque, and zones of calcification. Zone of calcification and volume of artery, about 10% only. And in this photo you can see atherosclerotic plaque and complication formation of thrombi in the volume of artery. In this photo you can see a scheme of atherosclerotic plaque. We see plaque formation, discover of plaque, necrotic zone, calcification, fibrin formation, and wall of artery. Clinical anatomical forms of atherosclerosis. Which vessels are affected due to atherosclerosis? I told that we see affected of large and middle arteries, but we can see affected of small arteries too. So 6 main clinical anatomical forms: atherosclerosis of aorta, coronary arteries, cerebral arteries, renal arteries, intestinal arteries, and arteries of lower extremities. And more about each of them. But before I want to describe you, in case of atherosclerosis of any localization, the manifestation can be dual. If the atherosclerotic plaque does not block the artery lumen fully, we see partial blockation. As a result, we see chronic ischemia in the organ. As a result, atrophy in the parenchyma and sclerosis in the stroma. If we see a full blockation of artery with help of atherosclerotic plaque, we see acute ischemia and appearance of necrosis or infarction in the organs and tissues. So atrophy and sclerosis, and infarction or gangrene. What about atherosclerosis in the aorta? More often we see affected of abdominal part of aorta. In the first and second stages we can't see clinical manifestation. Only in the third and fourth stage, as a result of destruction of atherosclerotic plaque, we see destruction of wall of aorta, appearance of thrombosis, and some complications, which thrombosis and thromboembolism, and thrombosis in this photo, and formation of aneurysm as a result of destruction of aorta wall. In this photo you can see aneurysm formation in the abdominal part of aorta. As a result, what can we see? Which complication? Thromboembolism in the mesenterial arteries and gangrene in the renal arteries and necrosis in the kidneys and gangrene of lower extremities. As a result of formation of aneurysm, we can see the complication rupture of the wall of aorta and bleeding, lethal bleeding. If we tell about atherosclerosis of arteries in the heart and cerebral arteries, underlies the coronary heart disease and cerebrovascular disease correspondingly, and we will tell about those diseases later. Look in this scheme, you can see a blockation of coronary artery leads to infarction in the heart, and blockation of cerebral artery leads to ischemic infarction or ischemic stroke in the brain. Atherosclerosis of renal arteries leads to the development of atherosclerotic macrotuberous kidney as a result of formation of many necrosis or infarction and organization of those infarction zones, formation macrotuberous, macrofocal atherosclerotic sclerosis in the kidneys. Look in this photo, you can see atherosclerotic nephrosclerosis. Atherosclerosis of arteries in the lower extremities leads to intermittent claudication as a result of partial blockation of artery by plaque, and to gangrene if we see full blockation of femoral artery by the plaque with combination with thrombosis. So in this scheme you can see affected of many organs as a result of atherosclerosis in many vessels. Ischemic stroke, myocardial infarction, intermediate claudication, and renal ischemia with macrotuberous nephrosclerosis. In this photo you can see gangrene of finger in the lower extremities. Atherosclerosis of the mesenterial arteries leads to the bowels gangrene. In this photo you can see gangrene of small intestine, total gangrene of small intestine as a result of atherosclerosis and thrombosis in the mesenterial arteries. The next disease, essential hypertension or hypertensive disease. What's this hypertensive disease? It's a chronic disease characterized by the stable rise of arterial pressure of neurogenic nature, not connected with the primary injury of any organ. What it means? We see neurologic cause of hypertensive disease. If we see affected of some organs, for example, kidneys, many diseases in the kidneys can lead to renal hypertension, or affected of endocrinal organ or brain, we can see cerebral hypertension, or as a result of tumor in the adrenal glands, we can see secondary hypertension. Essential hypertension means affected only neurogenic etiology without affected of those organs. A normal pressure, arterial pressure in the middle man 120 and 80 millimeters of mercury. Which risk factors or etiological factors for essential hypertension? And first, this neurological origin. In first place, we must stay stress and psycho-emotional overstrain. Besides, we see in the patient with arterial hypertension heredity and increased use of sodium chloride, table salt. As a result, we see increase of volume blood volume. There are two courses. We told that arterial hypertension is a chronic disease. As a result, which course can we see? Malignant is acute and aggressive course, and benign more favorable course, more prolonged course. What about malignant hypertension? This aggressive, I repeat, and fast course. Diastolic pressure very, very high, about 120 millimeters of mercury. More often we see in young men, about 30-35 years old. Renal form is dominant. What can we see in the kidneys? In the kidneys, we see fibrinoid necrosis of arterioles and capillary loops of glomeruli, and acute renal failure is appearing fast, without stages in the malignant hypertension, and cause of death, acute renal failure and cerebral hemorrhages. Look at this complication of malignant form of arterial hypertension. What about benign course of hypertension? In this form, we can see stages. There are 3 stages in benign form, which preclinical, we see increase of arterial blood, about 140 and 90 millimeters of mercury. We can see anatomical changes, maybe light hypertrophy of left ventricle, about 1.3 centimeters. The next stage, generalized change of small arteries and arterioles. What can we see in this stage? We see infiltration, plasma infiltration and hyalinosis in small arteries. And in the third stage, through several years, we see secondary changes in the internal organ connected with the changes of arteries and derangement of intra-organic blood flow. Look more often, preclinical stage, transition hypertension, hypertrophy of muscle layer in the arteries, and moderate compensatory hypertrophy of myocardium. In the second stage, stable rise of arterial pressure, we see plasma infiltration and hyalinosis in small arteries, elastosis, elastofibrosis in the large arteries with sclerosis and fibrosis. Myocardial hypertrophy is increasing more than 2 centimeters maybe. In case, please remember, in case of hypertension combination with atherosclerosis, the fibrous plaques are forming even in the small arteries, for example, in the brain arteries and heart arteries. Look, in this photo you can see plasma infiltration in the artery and hyalinosis, elastosis in the large arteries, and hypertrophy of left ventricle, bull heart formation. And in the third stage, we see dystrophy in the parenchyma of internal organs, atrophy of parenchyma with sclerosis in the stroma, arterial occlusion with spasm, thrombosis, fibrinoid necrosis, infarctions, hemorrhages. What can we see? Cerebral hemorrhages. In the kidneys, appearance of primary wrinkled kidneys as a result of hyalinosis and sclerosis of many glomeruli. Look, in this photo you can see primary wrinkled kidneys. What can we see? Kidneys are decreased in size, have solid consistency and small granuled surface as a result of halinosis and sclerosis of glomeruli. In this picture, you can see number one, this large arteries with elastosis and fibrosis. Second, this halinosis and sclerosis of glomerulus. 3, tubules, and 4, normal glomerulus. In this photo, you can see manifestation of third stage of hypertensive disease in the left side and a hypertensive crisis in the right side. First picture, hypertrophy of left ventricle. Second picture, halinosis of glomerulus in the kidney. Third picture, fibrinoid necrosis of arterioles, and hemorrhages in the last photo in the brain. Hemorrhages in the retina, hemorrhages in the brain can appear. The next disease, coronary heart disease or ischemic heart disease. What's this coronary heart disease? It's a group of diseases caused by the relative or absolute deficiency of coronary blood flow. As a result, we tell about coronary heart disease. In 1965, we start to name this disease. We told relative and absolute. As a result, acute and chronic. If we say absolute blockation, absolute deficiency, we tell about acute course of coronary heart disease. If we say relative blockation, partial blockation of artery, we tell about chronic coronary heart disease. Which background diseases for coronary heart disease? This atherosclerosis, hypertensive disease or arterial hypertension, and diabetes mellitus. What about acute coronary heart disease? There are 3 forms of acute form. It's sudden coronary death, acute focal ischemic myocardosis or dystrophy, and myocardial infarction. What can we see due to sudden coronary death? It is a death developing during the first time after onset of the heart attack, up to 6 hours. Electrocardiographic results change of Q and T valves, ST interval. Blood ferments don't change. Macroscopically, we can see ischemic zone. That's all. Histochemically, decrease of dehydrogenase activity and glycogen quantity. And cause of death, lethal arrhythmia. What about acute ischemic myocardosis or dystrophy? Is a death developing during the first 6-12 hours after onset of the heart attack. Electrocardiographic results change of Q and T valves and ST interval. Blood ferments, creatine kinase increase, transaminase increase. Macroscopically, salts of potassium, tellurine, and tetrazolium we see appearance. Staining. Histochemically, decrease of dehydrogenase activity, glycogen quantity. And cause of death, lethal arrhythmia too. Histologically, we can see dystrophy, parenchymatous dystrophy in the cardiomyocytes. And myocardial infarction, we can see through 6 hours after heart attack, start of a heart attack, only histologically. Anatomically, myocardial infarction we can see through 1 day only, 24 hours. Which immediate cause of myocardial infarction? Thrombosis, embolism, prolonged spasm, atherosclerotic plaque, and functional overstrain of organ in the hypertrophic heart, for example. Which classifications? There are many classifications of myocardial infarction according to the onset time, is primary or acute. Recurrent second or third or fourth and other infarction after first primary in time 28 days. And repeated second, third and other infarction after primary after 28 days. The next classification according to the localization. More often we see a formation of myocardial infarction in the left ventricle, in the anterior wall of left ventricle, posterior wall, lateral wall of left ventricle, in the interventricular septum, or extensive infarction in many zones of left ventricle. The next classification according to the prevalence: subendocardial, subepicardial, intramural and transmural. Cause of death may be only transmural infarction or combination of subendo, subepi, intramural with another disease. In this photo, you can see anatomical picture of myocardial infarction through one day. What can we see? We see irregular form and ischemic infarction with hemorrhagic crown. Myocardial infarction 2. Histologically, what can we see? In first hours, we see disappearance of nuclei. We see cardiomyocytes without nuclei, and we see lysis of cell membrane and homogenization of cardiomyocytes. Lysis of cardiomyocytes. In this photo, you can see hemorrhagic crown. What can we see in this zone? We see increased vessels, hemorrhages, and demarcative zone, accumulation of leukocytes and macrophages. This demarcative zone 2 with hemorrhages and destruction of cardiomyocytes. In this zone, we can see appearance of granulation tissue after infarction. We see replacement zone of infarction to connective tissue and formation of scar formation, post-infarction macrofocal scar. There are 4 stages of infarction. Pre-necrotic stage, we see dystrophy. Necrotic state, this first 3 days. After 3 days, we see organization up to 28 days. And after 28 days, we see post-infarction changes. We see formation of scar, rough scar. Which complications due to myocardial infarction can you see? Cardiogenic shock and asystolia, acute heart aneurysm formation with rupture, myocardium rupture, and hematompanate. This absolutely lethal situation. Thromboembolism in the endocardium, pericarditis, acute heart failure, and pulmonary and brain edema as a result of acute venous hyperemia. In this photo, you can see pericarditis, hematompanate, hemopericardium as a result of aneurysm formation and rupture of aneurysm. The next information about chronic coronary heart disease. There are 3 forms: atherosclerotic microfocal cardiosclerosis, post-infarction macrofocal cardiosclerosis, and chronic heart aneurysm. In this photo, you can see macrofocal cardiosclerosis after infarction, aneurysm formation, and as a result of formation of atherosclerosis in coronary vessels without full blockation, we see diffuse macrofocal cardiosclerosis, the result of atrophy, chronic ischemia, atrophy, and sclerosis of stroma. Number 1 is sclerosis. Number 2, muscle cardiomyocytes. And the last information about cerebrovascular diseases. What's this definition? Is acute derangements of cerebral blood circulation, background of which are atherosclerosis and arterial hypertension. As a result, background diseases, atherosclerosis, and hypertension. We start to name this disease in 1977. Classifications of cerebrovascular disease. We can see two main variants with ischemic brain damage and intracranial hemorrhages. Ischemic and hemorrhagic affected. With ischemic brain damage, is ischemic encephalopathy, ischemic cerebral infarction. Ischemic encephalopathy we see due to partial blockation of cerebral arteries. Cerebral infarction with the result of full blockation with help of thrombosis, embolism, and atherosclerotic plaque with spasm. And hemorrhagic cerebral infarction, the secondary hemorrhages after ischemic infarction. What about intracranial hemorrhages? We see a rupture of vessels, intracerebral, subarachnoid, and mixed variant. What about ischemic brain damage mechanism? We see stenosis, stenosing atherosclerosis of cerebral arteries with thrombosis and thromboembolism maybe, or spasm. And hemorrhagic component in ischemia zone is caused by erythrocyte diapedesis in demarcation zone. In this photo you can see ischemic infarction with formation of cyst. This formation of cyst is the result of lysis of necrotic zone in the brain. After infarction, ischemic infarction with the formation of cyst with white wall in the brain. What about intracranial hemorrhages mechanism? With a rupture of pathologically transformed wall of the cerebral arteries. As a result, massive diapedesis of erythrocyte and cerebral arteries aneurysm rupture maybe. These massive hemorrhages, subarachnoid, for example, or intracranial with spreading to ventricle. That all information, and thanks for your attention.